Sophie, as you know, we have talked, you told about challenges and issues around FASD, but I think it'll be good to, from a listener's and a viewer point of view, to get a bit more understanding on what FASD is and what we already know.
Yeah. Thanks, Dev, because I think that's probably something that some people listening today might be wondering. It's, my journey started probably in my early 30s after I'd had my first son. And I was actually asked to help somebody with their thesis research and ask my group, my mother's group, around their alcohol usage in pregnancy. And it was done in such a way that was, very non-stigmatizing, non-judgmental. And I realized at that point that people's perspectives around alcohol use are really quite different and very varied, even though we may have all lived in a, suburbia in Perth with very similar social groups and similar backgrounds. And that journey sort of, years later crossed over into starting to work for NOFASD as the national organisation for people living with fetal alcohol spectrum disorder, and also their parents and caregivers, and really sort of seeing at that time, doing my research and delivering training and learning for the first time that there's actually no minimum threshold effect for a diagnosis of FASD. So it can actually be really low levels of alcohol exposure. And because I'd only ever worked with families who had sort of quite severe life experience and higher levels of alcohol exposure, I assumed that could only in fact impact people there. Probably what's really sort of unknown is the impact of alcohol on the developing brain. And because it's a neurotoxin, the impact is really quite significant and impacts many domains of the brain. There's actually 10 domains of the brain that are assessed in a fetal alcohol spectrum disorder diagnosis. So it's really very wide and varied, and it's often misunderstood. It's misdiagnosed or a missed diagnosis. And that's for many reasons, one of those being stigma, because people won't ask that question around alcohol usage in pregnancy. It's thought to be judgmental, and yet I'd be quite happy to ask about many other lifestyle factors. So sort of changing that approach needs to happen. But also because the impacts of alcohol on the developing brain can be very similar to those of early childhood trauma. And therefore it's often misunderstood to be trauma. Not to say trauma can't be a part, but it's quite often co-occurring. And that's not necessarily understood. We're looking from international studies from the US and Canada that the prevalence of FASD is likely to be between 2 and 5% of the population. When you consider that would actually be more individuals in Australia than autism, cerebral palsy, spina bifida and Down syndrome combined, you start to actually realise it's a significant public health issue. Absolutely. So, and really starting to understand that FASD is a physical brain-based disability is something that's so important.
And I think it's the numbers which you're sharing is fairly, intriguing, and there are so many things to be done around. And if this is a big public health challenge, it should be made more aware to everybody that, it is what it is, and talked about around the facts.